At Integrated Health Services, we've developed a system to force down the cost of health care while simultaneously increasing the quality of patient care and compliance. We approach this problem with a three-pronged solution. Management Services Organization. We bring together groups of doctors, hospitals, and other healthcare providers who come together voluntarily to give coordinated high-quality care to their commercial medical patients. The goal of coordinated care is to ensure that patients get the right care at the right time while avoiding unnecessary duplication of services and preventing medical errors. We are also able to leverage our numbers and negotiate group contracts, driving down the cost of healthcare. When our MSO succeeds both in delivering high-quality care and spending healthcare dollars more wisely, it will share in the savings through federally compliant quality bonuses. Smaller providers have expressed a concern about their lack of ready access to the capital needed to invest in infrastructure and staff for care coordination. The administrative services model is meant to help smaller providers with less access to capital participate in our program. MSO services frequently include activities such as billing and collection, administrative support in certain areas, and electronic data interchange, e.g., electronic billing. In some cases, we provide a broader set of services. We contract with blood labs, pharmacies, hospitals, surgical centers, and other entities to provide their administrative services. We often subcontract out those services. In spreading the cost and obligation for services, we are able to dissipate the cost of manpower and other overhead, thereby further decreasing the cost of health care. Our MSO can reduce costs by bringing economies of scale and professional management experience into physician practices, thereby improving operational efficiency and reducing overhead costs. Utilizing technology. Credible care management plans and analytics to drive quality and cost reduction require significant infrastructure. Using technology, which can guide the management services organization to provide the expertise, resources, and analytics, can help unlock the true value for its physician owners and members. Using our proprietary cloud-based software system, Portico, we are able to manage patient care. Portico is interfaced into the Centers for Medicare and Medicaid Services and aids the practitioners in making healthcare decisions in such a manner that is consistent with federal medical necessity guidelines. We were able to establish qualitative bonuses when their compliance with this program causes a reduction in healthcare costs and shorter lengths of patients in the healthcare revenue cycle. Portico differentially diagnoses patients according to evidence-based medicine, and then according to those diagnoses, informs the providers regarding which procedures, testing, diagnostics, and modalities fall into federal medical necessity guidelines. To further decrease administrative costs, Portico allows for the providers to coordinate patient care, share files in a HIPAA-compliant manner, utilize telemedicine, and refer right from their desktops, laptops, or even their cell phones. National Medical Debt Advocates. Under our National Medical Debt Advocate subsidiary, we take the fight directly to the providers. It's estimated that as much as 90% of medical bills are inflated. Sometimes they are inflated because of ineptitude. Sometimes they are inflated because of laziness. Sometimes they are inflated deliberately so that the provider can see more money. Medical debt is the number one reason that people in the United States file bankruptcy. The majority of that debt is not from prolonged care, but rather from sudden, unexpected care. Very often, an ER bill for a slight fever will render a $3,000 bill. Unfortunately, sometimes that 2 hours in the ER will render a $20,000 bill. What we do to reduce medical debt. We look for errors by comparing the insurer's explanation of benefits to the bill, and then help lodge an appeal to insurers or healthcare providers. We use our expert knowledge to identify procedural and administrative errors, policy breaches, and provider fraud and abuse. We negotiate charges with hospitals or doctors and can apply for financial aid, known as charity care, with a facility. Integrated Health Services, doing our part to create a better healthcare system.